Perfect.
Very loud. I see coming.
I believe you.
Come in!
Hi, I'm Carly. I'm a nursing student at MCC, and I'm going to be your nurse today. Well, your nursing student today. I have to do a general assessment on you. Is that correct? Yeah? Okay.
And I just say some my ears.
Yeah. So what is your name?
Kaden.
What's your last name, Kate?
Wiggins.
Good job. And do you know what your birth date is?
21st.
Yes. What month?
October.
Yeah. Do you know the year?
What year?
When were you born? What year were you born in?
2015.
Yes. 2015. You're absolutely right.
2015.
Good job. Okay. So this is Caden Wiggins. We took his vital signs earlier. He had a blood pressure of 112/64. He had a pulse of about 120 beats per minute. It was 122, but I think he's just a little excited. His respirations are 20 breaths per minute. His temperature was 98.6. Oh, everything's good there. His height, I don't have a way to measure his height, and I don't know exactly what it is. But I do know that his weight is 36 pounds, so he is in the lower percentiles for his weight and his height.
Wait
I know
a
that.
minute.
What?
What's that?
That's my school logo. It says Muskegon Community College.
That's cool.
Thank you. Very cool. Okay.
I'll do this of it.
So I have to ask you a few questions, Kaden. I'm just gonna say that okay. So go ahead. So I'm looking at his face. I'm looking at the symmetry of his face. I'm looking at the symmetry of his body. Just as I'm here looking at his arms, I'm looking for any rashes, any lesions, anything like that.
Why is she calling us?
I'm looking for any rashes, any lesions, anything
Why is that guy
like that.
calling us?
Baby, it's okay. It doesn't matter. Sit down, please. Sit down. Sit down, please. I'm looking for any rashes, any lesions, anything like that on both his body. And now I'm going to check his scalp. Kaden, please.
Just super excited.
Can you please just, I know you're very excited. Can you just sit down, please, so real quick? Bob, I have to check your hair, okay? So I have to check his hair for any lice, any mites, any rashes, any lesions, anything like that. There's something like that in here. Lice, no lesions. His head is symmetrical. His hair is undyed, blonde, and appropriate. Everything looks really good. Okay. Any soreness where I'm touching?
No.
Okay. All right. Now we have to look at your face. Okay. So I have a few things to ask you about your face. Okay. Can you look at me? Can you look at me? Okay. So I'm looking at his face and making sure that it's symmetrical, and that his eyes line up at the top of his ears, which they do. That his nose and his mouth are in the middle, which they are. Everything looks really good. And he's moving his eyebrows and making lots of facial expressions, which is really good. Okay, so I'm going to look. I have to look in your eyes real quick, okay? I have to look in your conjunctiva and sclera, which is really good. Your conjunctiva is pink and your sclera is white, which is the way it should be. I don't see any drainage. Okay, so we have to check your nose. Can you breathe in? Breathe out. Breathe in. Breathe out. Okay, can I check in there? In your nose? In your mouth? Ah. Perfect. Can you move your tongue? Stick it out in there. Perfect. All right, I see you have all your teeth. They all look very clean. Your tongue and your nose. Yeah, and your mouth are pink and moist, which is the way they should be. Is there any pain in your mouth?
No.
Okay, can I check your ears real quick? Okay, there's no drainage. There's no redness. Everything looks appropriate. Good. Okay, any pain when I touch your ears?
No.
No? Okay. I'm going to palpate his lymph nodes. Hold on. No? Okay. None are palpable, so I don't see any lymphedema. That's good. That's appropriate. Okay, calm down. Okay, give mommy a minute. Give mommy a minute. I just need to collect my thoughts. Okay, sit down, please. Sit down, please. Sit down, please. This is also where I would check his gag reflex, but I don't have a tongue depressor, and also I don't want to stimulate that because he will puke. He has a very weak gag reflex. Pukes very easily. Okay, and I can see by the way he's moving his head and the way he's moving, his arms. He's got very good range of motion. Nothing seems to hurt him, which is really good. But I also was inspecting. See this? His arms for symmetry, for size, all that stuff. Can I check your pulses, please? Good. 2+. Oh, I have to check your eyes real quick. I have to do this. Can you look at me? Remember, look right at my nose. Right at my nose. Look at my nose. Okay. His pupils have perla. Patient has perla. So his pupils are equal, round, reactive to light, and accommodating. Can we look at this? Ready? Sit still. Don't move your head. Don't move your head. Just your eyes. Don't move your head. Okay. So I don't see any where his eyes vibrate. I don't see that. Very good. Everything looks really good. Right. So, okay, come here. I have to listen to your pulses real quick. Can I just see your... Sit down, please. Sit down, please.
I'm a bit higher than you.
I know you are.
But I'm a bit lower.
Okay. All right. Pulses are good. They're about a 2+. His cap refill time is under 2 seconds, which is appropriate. Also, I forgot to say, but his pupils are about a 2, which for him is normal. And it is normal and appropriate. Can you grab my fingers? He's squeezing real tight. Perfect. Okay, so I'm going to do this. Can you push against him with your hands? There you go. Now I do this. Can you pull him towards you? Like this? Yeah, can you pull him towards you? No, not with your body, with your arms. There you go. Perfect. So they are equal bilaterally, his strength in his arms, which is appropriate. All right, so now I'm going to be listening to his lung sounds. Okay, so I'm going to listen to your lung sounds, okay? I'm going to listen anteriorly. Caden, please stop. From the clavicle down to the apex of the sternum, which is about the 8th rib.
Somebody's calling you.
Which is about the 8th rib. And posteriorly from C7 to T12. The bronchial sounds are from the top, and they are louder on inspiration versus expiration.
Why is everybody calling you?
I don't know, baby, but shh. We're trying to do this for school, please. Bronchial, vesicular, Caden, please stop. Which are in the middle, and they are equal. That's equal on inspiration versus expiration. And the vesicular, which is the peripheral of the lungs, and that is louder on expiration versus inspiration. Okay, so I'm going to listen to your lungs now, okay? Thank you. All right, so remember, sit up straight. Breathe in deep. Breathe out all the way. Good. Breathe in deep. Breathe out all the way.
Oops.
Don't do that, sweetie. Breathe in deep. Breathe in deep. All the way. Out. All the way. Good. Breathe in. Breathe out all the way. Breathe in. Breathe out all the way. Good. Good. Now we're going to listen on the back. Sit up straight. Do it again. Okay. So his lung sounds are equal bilaterally. There was no adventitious lung sounds noted. I would be looking for like a rhonchi, a wheezing, a crackle, anything like that. And I didn't hear any of that. Bubba, can you sit down, please? Oh, shoot. I also forgot to ask him to read something.
Well,
Can you?
I love you.
Good. Can read. Which is good, which is appropriate. And also in the beginning, I would have done an eye exam, but I don't have that for him to look at. But he does get checkups, and he has 20/20 vision, or what's appropriate. Yes, baby, his regular vision, and his hearing is also good. But I can do the whisper test also, which I should do. So what did I say?
Cheese.
Good job.
Milk.
No, good. So he can hear, which is good. Hearing out of both ears, which is appropriate. Now I have to listen to your heart rate, or to your heart. So I'm going to listen at the 5 posts. Ready? Just sit still.
An airplane. I hear an airplane.
Don't move. Don't move.
I hear an airplane.
You hear an airplane?
Yeah.
Okay. So S1 and S2 were noted. I was listening for any murmurs, any irregularity, which there wasn't. It was regular. It was a very good sound. It didn't sound overworked or tired. The heart itself didn't have any swishing or anything like that, which is appropriate. So I'm so sorry. Okay. Okay. Your bladder, or your stomach. Okay. So also at this point, I would check to make sure that, his chest is round, appropriate size, which it is. This is half of that, which is what it's supposed to be. But also I'm supposed to do these tests. So sit up, please. Can you say 99? No, louder.
99. 99. 99.
Good. And the vibrations get softer as I move down his back, which is appropriate. And then I have to breathe in, breathe out. Good. And I was looking for his rib cage to expand and retract appropriately, which they do. So can you sit down, please? So now we're going to lay down. And I'm going to look at his stomach. Hold on, sweetie. I think the camera needs to. Okay. All right. Okay. So, no, Baba, please. Just stay still for me. So now I'm going to look at his abdomen and his chest. Once again, I'm not seeing anything. It's round. It looks good. His abdomen looks soft. I don't see any noticeable distension or anything like that. Okay, do you feel any pain in your stomach?
No!
Okay, I'm going to listen to it, okay? Just stay completely still. Very gurgly. No, stay still. Good job. Okay, so his bowel sounds are active in all 4 quadrants, which is appropriate. Okay, so now I'm going to touch it out, okay? You tell me if this hurts. Does anything hurt?
No.
Okay, soften for me. Relax. No, relax. Relax, Baba. Yeah.
Who's barking?
I know, I hear him.
What's he barking
He's barking at a squirrel or something, I'm sure. Okay.
at?
Can you just wait till we're done? So he didn't notice any pain. I didn't feel any masses or anything like that. And I even checked for his bladder. There's no bladder distension or anything like that, which all is appropriate and feels really good. So can we turn around? Okay, please.
Turn around.
Not like that, sweetheart. We'll just do it with you. We just have to check your range of motion. Can you lift your legs and move your legs? Although you've been doing that, yeah. I think you got good range of motion because you've been moving around like a crazy man. I would have also at this time checked his genitals for and perineal and anal regions for any parasites or anything like that, any drainage, any rashes, anything abnormal. But he's fine. And I'm not going to do that on the camera. But then next I'm going to check the legs. I'm going to check for symmetry on the legs. Yeah. I'm also looking for redness, edema, anything like that, any signs that our circulatory system isn't draining correctly or that maybe there is a clot. Not very likely on kids his age, but good to check for. Get your hands out of your pants, weirdo. I'm going to assess for his pulses. Can you stay very still for me? Okay. Okay, those are strong, about a 2+. Check his cap refill time, which is less than 2 seconds, which is appropriate.
Catfish.
You're going to catch a catfish. Okay, baby. Okay. We need to, he bent over earlier, but I still need to have him show you guys, I guess, his spine and stuff. So come here, big boy. All right, can you stand up straight for the camera like this? Okay, now I need you to bend over. Can you bend over just like that? Perfect. And I'm checking his spine for any signs of scoliosis. You will see one arm up higher than the other, which it's not. It's equal. It is right down the middle. I don't see any signs of kyphosis or lordosis or anything like that. So everything looks really good. Can you walk over here? There you go. Can you walk back? Good. So he has a good gait. Very steady. Can you stand on one foot? Can you look at the camera and stand on one foot? No balancing. Come here. All right, stand on just one foot. Don't. Yeah. Good. Can you stand on the other foot? Good. Okay, so he has good balance. Can you kind of jump? Can you jump? Good. Can you skip?
Skip.
It's like sort of. All right, that's a good try. He's able to hop around. He's able to move. Everything looks really good. So to review, I found nothing abnormal. Everything looks really healthy. His vital signs, his he's alert and oriented ×4. He's answering questions appropriately. He's good. He sees fine. He hears fine. I don't see any rashes, anything like that. Okay, Kaden. Thank you. Thank you for letting me check you out. You have a good day, okay?
Yeah.
Okay, and I would wash my hands and I would leave the room. Thank you.